Hi, my name is Jessica Russo, and today I will be talking to you about animal-assisted therapy and anxiety in pediatric patients. So the clinical problem. The medical setting and procedures that take place in the hospital can be stressful and intimidating for children. 2.57 million children under the age of 15 were hospitalized in 2004. 35% of all children in America experience stress-related health problems. Anxiety and distress can heighten the perception of pain, often causing the patient to need medications to help soothe the pain and lower anxiety levels. Due to the opioid epidemic in America, more of an effort needs to be put on non-pharmacological interventions, especially in children. The purpose of this study: animal-assisted therapy is an individualized, non-pharmacological intervention that is part of a patient's treatment plan. It is often used for people who have physical, social, emotional, or cognitive needs. Animal-assisted therapy is more than just visiting and petting an animal. Motor skills, such as opening a container of treats and breaking them into pieces, or taking a dog for a walk, are interventions that are included in AAT. Animal-assisted therapy is not a common intervention seen in all pediatric hospitals. The purpose of this project was to evaluate the effects of animal-assisted therapy on anxiety levels of children in the medical setting. I am a nurse at Nationwide Children's on the general medicine floor. I've gotten to see an animal-assisted therapy dog on our floor a few times, but it's not something commonly seen. I actually spoke with our child life specialist, who is an awesome resource for us to have. She helps with scary medical procedures such as putting in an IV, and has all kinds of distraction techniques for the kids so they don't get super scared. And she mentioned to me that on our rehab floor, they actually have a animal-assisted therapy dog that they use quite often, but they don't use it throughout the hospital very much because of the fear of infections, which I found an article about, so we will be talking about infections here shortly. So my PICO question is: in pediatric patients in the healthcare setting, how does participating in animal-assisted therapy compared to not participating in animal-assisted therapy affect the patient's anxiety levels? A literature review of 6 articles was performed. The articles were retrieved from CINAHL and PsycInfo. Search terms including animal-assisted therapy, pet therapy, children, pediatric, and hospital were used to find the articles. The search was limited to articles that had full text available and ranged in publication from 2009 to 2019. 2 quasi-experimental articles, 2 RCTs, and 2 literature reviews were reviewed. Each of these articles looked into animal-assisted therapy that focused on canines. The first article I looked at was an RCT by Baker. It was performed at Children's Hospital of Richmond, Virginia. It looked at animal-assisted therapy compared to the assembly of an age-appropriate puzzle. Children had to be between the ages of 8 to 18 years, not have an allergy or be afraid of dogs, no cognitive disorders or language delays, and not be anticipated to be discharged within 48 hours to be able to participate in this study. The recruitment continued for 12 months until 40 children completed the study. So the patients were broken into 2 groups. One group performed animal-assisted therapy, while the other group assembled an age-appropriate puzzle. So This study was measured by self-reported anxiety scores. So before and after the intervention, patients rated their pain and anxiety on an 11-point system, 0 being no pain or anxiety, and 10 being worse pain or very nervous or afraid. Children who were 12 to 18 years old also completed the attachment questionnaire for children to find their attachment style. The family and life space diagram was also used to assess children's closeness with their families. So this article found that both animal-assisted therapy and the assembly of a puzzle helped reduce anxiety scores in children. Animal-assisted therapy was slightly more effective in reducing anxiety, but there were no statistical significances in the difference. A limitation of the study was that anxiety scores before the implementation were not even. So 60% of the animal-assisted therapy group and 25% of the puzzle group reported scores of 0 before the intervention took place. So this may have skewed our results a little bit on the outcomes of the patient's anxiety scores. So our next article was an RCT by Shuck, and it actually focused on ADHD. It was a little different compared to the other articles I reviewed in my paper, but I'm going to go ahead and talk about it anyway. So in order to be involved in this study, children had to be between 7 to 9 years of age and had to have a diagnosis of ADHD combined type. They could not be on any medications for ADHD, have a diagnosis of pervasive developmental disorder, depression, anxiety, epilepsy, and no cruelty to animals. 24 children were randomly assigned to intervention and control groups. So the control group for this study received cognitive behavioral therapy, which included the use of toy dogs, and it also included weekly parental behavioral therapies. The intervention group also received cognitive behavioral therapy as well as the weekly parental behavioral therapy, but it also had animal-assisted therapy with 3 certified therapy dogs. So this study looked at parents' ratings before, throughout, and after the interventions to see how the severity of their children's ADHD changed throughout the study. So it was found that the severity of ADHD decreased in both the control and intervention groups based on parental ratings. There was a greater reduction in the patients who received animal-assisted therapy. They found that the dogs helped the patients be present in the moment and draw their attention back when they were sidetracked. So as I mentioned, a limitation of this article is that it only looked at ADHD instead of our inpatient population, and it didn't really focus on anxiety. But it did show that animal-assisted therapy is beneficial in other diagnoses and other settings. The next article I looked at was a quasi-experimental study by Chabak. It focused on oncology patients. It was done at Seattle Children's Hospital. Sorry, make that a little more clear for you. It took place on an oncology unit. all of the patients had to have a diagnosis of leukemia, lymphoma, sarcoma, or brain cancer. There were 9 females and 10 males that ranged in age from 7 to 25 that were present on at least one of the 25 days that the dog was on the unit. So they were excluded if they had a recent bone marrow transplant, viral respiratory contact or enteric precautions, or any allergies to dogs. So all of the participants of this study got to participate in animal-assisted therapy. There was no minimum amount of time that they had to spend with the dog, but they only could have a maximum of 20 minutes. There was the same handler and the same dog and the same precautions used with all of the patients. So there were several things that were measured in this study, one of which was the PEDS QL present functioning scales. And this looks at different emotional things such as worry, anger, discomfort, pain, scared, and it was surveyed before and after the intervention, and it was found that there was an overall reduction in emotional distress and a major decrease in worry and tiredness. There was also direct observation from the research assistant, and they noted that after AAT, patients were more eager, smiled more, seemed more animated, and more relaxed. The patient's electronic medical records were also reviewed. They looked at infection control. As I mentioned, this is something that holds a lot of organizations back from possibly implementing animal-assisted therapy. So infections were monitored for up to 14 days after the animal-assisted therapy visits. Patients did get some infections, but none of which were found to be related to the animal-assisted therapy. 48 staff members were also surveyed, 48% of which were nurses, 25% physicians, and 27% ancillary staff. 86% of the staff felt that the animal-assisted therapy had a positive effect on the patients, and it also seemed to increase staff satisfaction. The article also mentioned that patients wished that they could have spent more time with the dog. So this article was very beneficial. Each of the measurements found animal-assisted therapy to decrease anxiety in the pediatric oncology patients, as well as have some staff satisfaction. A limitation of the study was that it only focused on oncology patients, but it can be related to some of our other studies that looks at animal-assisted therapy in the inpatient setting. My next quasi-experimental study that I looked at, similar to our RCT by Baker, looked at animal-assisted therapy compared to the assembly of an age-appropriate puzzle. So convenient sampling was done to recruit 15 children aged 7 to 17 with chronic conditions who were admitted to pediatric units at the participating hospitals. They were excluded if they had severe pain, fever, dehydration, if they were NPO on a type of precaution, or if they had an allergy or were scared to dogs. So in this study, patients in both groups got to participate in both interventions. So on the first day, one group participated in 6 to 10 minutes of animal-assisted therapy, while at the same time the other group participated in 6 to 10 minutes of assembly of an age-appropriate puzzle. On the next day, the group switched and did the opposite intervention. So this article looked at physiologic indicators of stress, such as systolic blood pressure as well as heart rate. So systolic blood pressure was found to decrease from before to during both interventions, but a few minutes after the assembly of the puzzle, it increased back to baseline, whereas both groups found that after the animal-assisted therapy, it remained lower. For heart rate, there was no significant differences between either of the groups. So they also looked at self-reported anxiety scores. They used the Child Medical Fear Scale. It was only looked at post-intervention. This scale ranges from scores of 20 to 60. 34 is a moderate anxiety level. The higher the score, the higher the anxiety. So after animal-assisted therapy, 33% of the children rated scores of 34 or higher, and after the puzzle intervention, 26% of the children rated scores of 34 or higher. So a limitation of this study is that these scores were only measured after the intervention. So we don't really know if there was a true difference after the interventions because we don't know what the baseline scores may have been. Another limitation is that it was a pretty small sample size. So it was very beneficial to have this article because it can be related to our RCT by Baker that used the same interventions. It also found that systolic blood pressure decreased in both groups with both interventions, and it rose slightly back to baseline after the puzzle group. So with this article as well as our other article on AAT versus the assembly of a puzzle, they do both show that animal-assisted therapy does help anxiety a little bit more than the assembly of a puzzle, but they both decrease anxiety in kiddos, which shows us that animal-assisted therapy can be compared to other non-pharmacological interventions such as child life therapy. So another article I looked at was our literature review. It was by Van Fleet. It had a lot of details on animal-assisted therapy, and it showed some stories of children who had some traumatic pasts and how animal-assisted therapy affected them. It looked at a little boy named Manny. He was 5 years old. He had a traumatic past, the history of neglect, abuse, and some turmoil. He was in a foster family. He was having a lot of temper tantrums, destructive, harmful to the family animal. So he was enrolled in animal-assisted therapy, which taught him a safe, respectful way to treat the animals, which in turn showed him a safe, respectful way to treat people. He also got to see how his actions caused reactions in the dog, and how to kind of like read the dog, his stance, how his tail was moving, to see how the dog might be feeling. He developed a relationship with the dog and got excited to see him, and got excited to show his foster family what he had learned. Another story in this literature review was about a little girl named Camille. Both of her parents passed away in a car accident. She had night terrors and was having some disruptive behaviors. So she participated in animal-assisted therapy, and it helped her open up with the therapist. She became attached to the therapy dog. She made a memory book of her parents and actually presented the memory book to the dog. This literature review by Tilish, it looked at what animal-assisted therapy is and compared it to other things such as service animals and activity animals, and it explained that animal-assisted therapy is truly part of a patient's treatment plan and is individualized to each patient. It also looked at the history of animal-assisted therapy. It has been used for a very long time. Sigmund Freud had a dog, and he found that it had a calming presence on his patients. Florence Nightingale also used what she called animal companion therapy, and she found that pets had a healing presence for her patients. There was also a Dr. Corison, who was the father of pet-assisted therapy. He had been working with a mute patient for quite some time, and after spending time with the therapy dog, he actually began talking. So some of the articles looked at within this literature review also looked at infection rates compared to animal-assisted therapy, and they didn't find any infections that were caused by the therapy. A few other studies in this literature review that I found were pretty interesting. It showed animal-assisted therapy in chemo patients and found an 86% decrease in depression ratings after AAT visits. The other thing was they had a dog in some of the waiting rooms, and it showed a decrease in discomfort, relaxing and distracting to the patients. Both this literature review and the previous literature review talked about future research in animal-assisted therapy and looking at other animals such as equine therapy. So our results, all of the articles that were reviewed found that animal-assisted therapy was beneficial in the reduction of anxiety in pediatric patients. Other than the article by Shuck, all of the articles were comparable in intervention and outcome. The RCT by Baker and the quasi-experimental study by Tsai both compared animal-assisted therapy to the assembly of an age-appropriate puzzle. Both studies got similar results. They each had a decrease in physiologic and/or self-reported anxiety scores post-intervention in both animal-assisted therapy and the assembly of a puzzle, with slightly higher decrease in animal-assisted therapy. The literature reviews both looked at background information of animal-assisted therapy, shared success stories of animal-assisted therapy, and provided data from previous studies that showed benefits of animal-assisted therapy. As I mentioned, the article by Shuck looked at ADHD and how animal-assisted therapy affected its severity. It was not necessarily relatable to the PICO question, but it did provide information. Sorry about that. It did provide other information on the benefits of animal-assisted therapy. So my recommendation for implementation would be to present this research and the findings to hospital leadership and talk with them about costs and budgeting, as well as how animal-assisted therapy could provide best outcomes to the patients. After getting the approval of leadership, we would pilot animal-assisted therapy on selected units. After the piloting process, we would assess the results. If they were successful, we would implement animal-assisted therapy throughout the organization. And after the implementation, we would continue assessing the effects of animal-assisted therapy and perfecting it. So, future research, most of the studies I looked at had some pretty small sample sizes, so I think further research should be done with larger sample sizes, with some strong research, with more systematic reviews, meta-analyses, and RCTs. I personally am a huge cat lover, so I think looking into other types of animal-assisted therapy, such as equine therapy or the involvement of cats or birds, would be interesting for patients who have allergies, a fear of dogs, to see how those may affect anxiety scores as well. Here are my references, and thanks for watching.